Right, good afternoon, everybody. I hope you had a good weekend. Along with Josh and Paul, we have Deirdre Gifford, Public Health, and David Lamont, Economic and Community Development, because we'll be thinking a little bit out loud today as regards the public health protocols and our reopening strategy and how we have to make adjustments given the numbers as COVID hits us. The daily summary numbers, I think, are what they are. These are three-day numbers. 2,650 cases is a lot of cases. 11 fatalities over 3 days, a 3.4% positivity rate. It's about 3.6 over the last 7 days, so there's no question about it. The trend line is continuing to trend up. I'd like to focus a little bit on the hospitalization numbers, up 11 over the last 3 days. What we've looked at in Europe, what we're looking at in the upper Midwest, we've seen those hospitalization numbers can change very quickly. And as you remember from back in the spring when we were flattening the curve to make sure we always had capacity in our hospitals to take care of folks related to COVID, we're thinking about that now, and that's why in order to flatten the curve, we're going to focus today on how we stay ahead of the curve and what changes we're proposing. The next chart is a reminder of what our priorities are and our goals. First and foremost is to slow community spread. And I will say what has changed for me in the last couple of weeks with a lot of guidance from Deirdre is if maybe we thought a few weeks ago that we could target our response town by town, keep these flare-ups from becoming wildfires, I think we're finding and looking around our neighbors, looking around the rest of the country that right now what were defined as flare-ups on a municipal basis are becoming more like community spread. Not nearly where we were back in April, but something we're watching very carefully. And what that means to me is that rather than think about how we respond now on a community-by-community or regional basis, I'm thinking more about how we respond on a statewide basis, and just as importantly, working very closely with our regional neighbors. I mentioned healthcare capacity before as the next key goal. It's not simply a matter of the fact that we've got 340 hospitalizations related to COVID. We had 2,000 back in April, May. So you say, hey, we still have a lot of capacity. But we're also trying to balance that with the fact that there have been an awful lot of necessary procedures that require hospitalization, not related to COVID, that were put off. So we're doing everything we can to see if we can maintain hospitalizations for non-COVID related as well. So that's part of our balance as we're thinking about how we flatten the curve on COVID and people going to the hospital. Keep schools and child care open. I think you know that that's been a real priority for me. What that means in terms of our kids' education, what that means in terms of our kids' social and emotional well-being, what that means in terms of schools being an early radar in terms of things that may be going on at home in terms of depression and addiction and a lot of the other symptoms related to COVID. Schools, we're doing our best to keep them open throughout this second wave. I can tell you that as I look around Europe, which is again, say 2 or 3 weeks ahead of us, I've been interested that as they move towards a lockdown in many cases, they're doing that in order to keep their schools open. And they understand in France and in Germany and Britain how important that is. It's worth noting that our universities are open and they're doing very well. That's not true in California and other places that closed down their universities. We always anticipated that there would be a surge at some point, in November, and the colleges thoughtfully always anticipated keeping their colleges open as long as they could, maybe until Thanksgiving break, and then they take a break and don't come back until late January, February. And I think we're going to be able to hopefully keep to that going forward. And finally, when it comes to keeping the schools open, it gets to sports. And we're in active negotiations, or discussions, I should say, with Rhode Island, Massachusetts, and our other neighboring states as we think about ways that we can keep our schools open. hopefully maintain sports to some degree, maybe not a lot of the interstate competition back and forth, since that's proven to be risky, especially as regards some of the winter sports where we've seen a lot of infections. We'll have some guidance on that over the next couple of days in association with our neighboring states. And finally, our goal is to minimize the economic impact to our economy and to our families and each and every one of you. And as you've heard David Lamont explain, we've got more of our economy, more of our GDP open than anybody else in this region, and certainly more than most states at about 88%. And that's the good news, and that's helping our budget, and that's helping a lot of families. By the same token, our unemployment is pretty steep, and that's because it's the service economy that's a little less impacted by GDP numbers, but they can really impact families, and they can really impact employment. And I'll talk about that as we move to the next slide. These are our recommendations that'll be mandatory changes going into effect as of Friday. We're doing this in close association with Massachusetts and Rhode Island and our other neighbors. Number one, moving our restaurants and back to phase 2 capacity. We were at 75%. Not many indoor dining got to 75%, but I think it sends a message. We're going to have 50% capacity. And we did worry that there were some tables that had an awful lot of people at them. Dan Harris mentioned this to me a number of times, that are acting more like parties, less like a restaurant. So we're going to limit to 8 people per table in a situation at those restaurants. And secondly, we want the restaurants, where you're serving alcohol to close by 9:30 p.m., same as our neighboring states are doing. Again, the reason being, at a certain hour, some of these restaurants start acting more like bars. We've had some issues at a number of these locations. Look, I'm sorry, almost all the restaurants are doing a really good job, but there have been some problems. We think 9:30 is a lot easier for our municipalities to enforce. You'll be able to still do takeout and the such thereafter. Personal services, hair, nail, and the such, they were at 75%. And we think they can stay at 75%. They've made enormous efforts there. People are wearing the masks. They've got the plexiglass. They've been able to maintain the distancing. And I think that has not been a source of spread. Our event venues go back to a limit of 25 indoors, 50 outdoors. Sounds a little chilly outdoors, but 50 outdoors. I'll tell you that we worked really hard, and David and I met with the event venue folks, and I know how tough this has been for them. We got them a month. They got some activity there, which is really good. But right now, people without masks, even in an event, even in a monitored event with caterers and the such, are just considered too risky. And our neighboring states are saying the same thing. You probably heard there's a big event venue in New Haven that did get a little bit out of control with Halloween parties. Not to single out any one type of business, but it's reasons why we continue to err on the side of caution. Performing arts, movie theaters, capped at 100 people. They haven't really been getting to 100 people, but that's still a message there. And finally, religious gatherings. This is a time, especially now, especially as we move into holiday season, especially with COVID, where we need our faith community more than ever. But we need you to be able to do that safely. So we're going to maximize capacity there at 50% or 100, and really emphasize the virtual worship services is by far the safest place to do, especially for your elder parishioners. I got to say, I was particularly touched, reading over the weekend about Michael J. McGivney, born in Waterbury, a priest in New Haven, recommended by the Pope for sainthood, and I take it when the Pope recommends something, that's usually a pretty good bet, and well-deserving. They had a wonderful service memorializing this. It was in Hartford at St. Joseph's, I think, and then they streamed down to St. Mary's. So the churches and houses of worship are using the streaming in an effective way. And it was just interesting to me that Michael McGivney, he passed away at a young age of 38, administering to people who were afflicted by the Russian flu back in 1889. So some things come full circle, and we appreciate his effort, and he's deserving of sainthood. Next up, just broadly speaking, additional recommendations so that it'll come as no surprise. We continue to urge and say with now more urgency, if you can work from home, telecommute, make those accommodations, employers, wherever you can. Postpone that non-essential travel. Might be even thinking about some away sports contests, ways that you can stay safe and stay closer to home. That's especially true, and we haven't repeated this in a while, for those who are older, those who are over 60, those who have pre-existing conditions. Again, much like we used to say a lot during the spring, stay close to home. If you're going out, end those gatherings, those social gatherings by 9:30 or so, smaller social gatherings, I'd like to say, so you can get home safely. And again, as always, if you have to ask, wear the mask. And if you can't keep that social distance outside, wear the mask. When you're inside, wear the mask. There's no more important recommendation that we can make. That gives you an idea of what our thinking is right now, ways that we think we can contain the spread, stay ahead of the curve, make sure that our hospitals have the necessary capacity they need, and do everything I can to keep our economy open, do everything I can to allow your kids to keep going to school. And again, in addition to Paul and Josh, ask Deirdre and Dave any of the tough questions. Thank you.
Channel 3 Eyewitness News.
With these new restrictions, Governor, it kind of sounds like we're heading down the path toward the restrictions that we saw in spring. Would you agree that we're kind of heading that way right now?
I think I'd put it a different way. We are putting in these restrictions on a statewide basis now to make sure we don't have to do more severe things later. Make sure that we can keep our restaurants open until 9:30 with the appropriate distancing and capacity. Make sure our kids can continue to go to school. But every week is a new day in COVID land.
And, are these changes going to be indefinite? Like for the restaurants, is there anything that's going to be done for them financially as we go into the winter?
Yeah, that's a very good question. I should have mentioned that. Look, we don't have, the federal support and the PPP and some of the things they had to support our restaurants and other facilities before, but we do have our shared work program. And I urge you, I know you're a restaurant, and now you're thinking, oh my gosh, at 50%, can I afford to keep on those 3 members of the wait staff? I only need them at half the time. We pay for the other half. So please go to Department of Labor. Please go online. Take a look at shared work. We're going to be there to support you as long as we can.
And finally, a question about Massachusetts. Where do we stand with the travel ban? Because for many who live along the border, this is going to be very tough for them to follow. Are we still working with Massachusetts on kind of crafting something?
Yeah, absolutely. We're going to have a resolution on that in the next 2 or 3 days. I promise you that.
So in the meantime, for those living on the border, any recommendations for them?
Stay safe, stay at home as much as you can, and otherwise be careful.
News 8.
Good afternoon. Governor, last week you had talked about what was happening in Europe, and you mentioned that again today, but also with respect to the your regional partners. Is this kind of a combination of what's going on in Europe and what Massachusetts is doing right now as well?
I'm not sure about combination, but when I look at Germany and France and Britain, I see cultures that are not totally dissimilar from ours and probably a few weeks ahead of us in the pandemic. So I do follow their response with some interest and share that with you. When it comes to our regional partners, Massachusetts, New York, Rhode Island, absolutely. What good does it do me to say our restaurants are going to have to close at 9:30 when they stay open till midnight. Remember, we had that same issue going back a few months. So we are working collaboratively, and they'll be doing the same thing with their restaurants as we are in Rhode Island and Massachusetts.
But by changing the times, if you say 9:30 instead of being open till 11 or anything like that, is that to try to sort of take away the kind of the party aspect, similar to what we saw at Anthony's Ocean View in New Haven last week? Does that sort of take some of that away, or is that the attempt anyway to take away by making it earlier, to take away sort of that partying?
I think there's a lot of truth to that. Look, again, overwhelmingly, our restaurants have been really good about following the protocols, knowing they had to earn your confidence before you went in there. But after a certain hour, we heard from a lot of our towns and municipal partners that enforcement was getting tougher. Some of these places were going later. There were a lot of people gathering, and we wanted to make it easier for them to enforce the rules as well.
Lastly, I think what they were talking about in Europe was one of the things that they were hoping to guard against with the measures that they did were leading to more unemployment and closures of businesses altogether. Obviously, you're trying to avoid that, but do you think this is a proactive way in that regard to try and do that and do this ahead of time while keeping a lot of room for, in hospitals?
You're exactly right. I'll hand this over to David Lamont as well, but we are trying to stay ahead of the curve just for that reason. If we take these precautions now, it makes it much more likely that our businesses stay open, much more likely that our schools stay open. Do you want to add to that, David?
No, Governor, I think that's exactly right. The reason we feel like acting now is appropriate is to avoid the larger shutdown later. So we are watching very closely what's happening in Europe, and we want to avoid it. So we think taking these measures now is a step to just do just that.
Fox 61.
Governor, good afternoon. I just kind of wanted to hop on the restaurant angle again. We keep seeing people at large parties like the club in Bridgeport and recently at Anthony's Ocean View, where several college students were at. I mean, what is being done specifically, though, for those people who won't comply?
Well, first of all, a little shout out to Bridgeport municipal officials, New Haven officials. They went in there and they were firm, and they closed these down, and they're going to stay closed down for the near term, and they can be fined as needed. And Paul Mounds is working with Consumer Protection to see what we can do in terms of liquor licenses. You can ruin it for everybody by not enforcing these rules.
NBC Connecticut.
Good afternoon. Governor, last week a regulation was added to outdoor dining saying that outdoor small enclosures like igloos are prohibited. Now, Millwrights was approved for their greenhouses today that they've been working on for a while. What about other restaurants that have also made these types of purchases and investments to try and extend outdoor dining in the winter months? Is there any consideration for that, especially now with this Phase 2.1?
David, you're our igloo expert.
Yeah, no, thank you for the question. So we as we have really since May, we continue to work with the Restaurant Association, and we're aligned in making sure that their restaurants and their customers operate safely. So we worked with Millwrights over the weekend, and we got comfortable with the greenhouses. What we're focused on is ventilation and new air coming into those vehicles and those structures. To the extent that there is ventilation similar to an indoor dining room, we're going to be comfortable with that. If it is a tent or a place where there isn't ventilation, we think there's significant risk of transmission, and that's what we're trying to protect against. With outdoor dining, we think that's really safe, and we want to work with these restaurants, and we'll do that this week to figure out ways to let them use and utilize what they've invested in. But really, ventilation is critical in reducing the spread, and that's where we're focused.
And Governor, are you planning on ditching the travel advisory list entirely and requiring everyone to test if they're entering like some other states are currently doing?
I know that New York is thinking along those lines. I don't think I am. I'll tell you why. I've just noticed that some states go on that list, and let's face it, it's about 90% of the country right now, including ourselves, to be blunt. But in a month or so, you may find that California has an incredibly low infection rate, and I'm not positive we want to quarantine them at that point. So I sort of think the way we have the metrics tied to infections makes some sense.
And the recommendation to stay at home 10 p.m. to 5 a.m., right now that's just a recommendation. Any plans to mandate that?
You want to speak to that, Deirdre or Josh?
So right now it's a recommendation, and it's designed to do some of the things that have been alluded to. You know, people are catching COVID from one another when we're together in groups and when we're together with people who don't live in our household. So the point of that advisory is just a very strong reminder to everyone that as we see infections go up now in Connecticut, the chance that somebody you're socializing with, the chance that that person has maybe an infection that has no symptoms is getting higher. So everything we can do to limit the time we spend with people outside of our households will help us decrease infection. So that's the purpose of this advisory right now.
And then just to be clear, phase 2.1 goes into effect right now, starting now?
I think 12 a.m. Friday morning, along with
Thank you.
Massachusetts.
News 12 Connecticut.
Hi, Governor. I know you guys are trying to avoid the worst case scenario here, but thinking ahead, at what point do we have to consider another shutdown of non-essential businesses?
If things get a lot worse. I can't give you an exact metric or an exact number. It depends whether it's regional, depends whether it's broad-based community spread. We'll see what's going on in New York and Massachusetts, our two neighbors, and maybe we'll get some highlights again from what's going on overseas. I hate to say it, Europe is in lockdown. I was talking to them again today, and the CEO said, I can't leave my apartment in Paris. Those are the rules. I'm pretty confident that's not going to happen here in the United States of America.
All right, and Governor, one other question. Thinking about the election tomorrow, if some sort of unrest breaks out, either on Election Day or later this week, what are you prepared to do to keep order? I mean, beyond local police stepping in.
Well, I was talking to Commissioner Ravella today, and obviously they are monitoring the social media very carefully. They're there just in case. I've seen what's going on in New York, and some of the stores are taking preventive measures here. It's not going to happen in Connecticut. Connecticut is going to be careful. We're going to respect the power of the vote and respect the decisions.
WTIC 1080 News. The Hartford Current.
Governor, you've been pretty adamant over the last month or so that restaurants were not the biggest factor that was driving the recent increase in COVID cases. So what has changed to make you want to restrict restaurants further?
Yeah, I don't see necessarily for those restaurants following the protocols that they have. But because we now have community spread, it's not like the restaurants are a flare-up. It's that if you have a 5% positivity rate, you have 100 people in a restaurant, there's a good chance that five people in there are infected, and you're indoors, and so it's really a good time to be particularly cautious there, especially as the evening goes on.
And so you mentioned that, you'd only take further action if things get a lot worse. I mean, it has sounded to me from talking with different experts that the expectation really is that things are going to get a lot worse. Do you have reason to think that all of these statistical models are wrong and that we're not headed for kind of a much more severe surge, or is that really your expectation?
Well, I'll take a crack at it, then maybe Josh can help me. But I'm looking, again, at hospitalizations. I'm looking at capacity. I'm making sure that we can manage our way through this. So when I say, well, things get worse, I look at around the country. I see that this number could ramp up. We heard Murphy and the models, and this could peak in December or even January. But the key metric I'm looking at is hospitalizations, as long as we can control capacity there. But Josh, you want to jump in?
Yeah, I think it's a good moment to remind people too that, all the models in the world are just based on a bunch of assumptions, and those assumptions are up to us to control. So the changes that we make to how we behave, how we interact with each other, the mask wearing, some of the changes the governor's announced today, impact what actually happens, right? How many people actually get infected and end up in the hospital and ultimately, sadly, pass away. So this is just the reason why the governor's taking this early action now, is to make sure that we don't experience some of the worst case scenarios that modelers can predict, and make sure that we do flatten that curve as quickly as possible.
But so these, are not the biggest, most dramatic changes. Governor, you've acknowledged that, restaurants weren't hitting 75% capacity anyway, and now they're back down to 50%. So what makes you think that these changes are significant enough to change the direction of this outbreak and contain infections in a way that would go against what the models are projecting?
I'm highly confident of nothing in this day and age. We started out hoping that enforcement would do it. Then we said, let's allow our municipalities to voluntarily go back to phase 2. Now we're saying our state's going to go to phase 2, and we're going to have some additional restrictions then, especially as regards, drinking and eating after 9:30 at night. Do I think that's going to necessarily solve things? We'll see. But as Josh said, basically, we do have the ability to control the spread. We do have the ability to bend the curve, and we'll do everything we can within our power to do that.
Thank you.
The Connecticut Mirror.
Hi, Governor. Could you talk a little bit more about the feedback that you've gotten from towns before making this decision? Was there concern, the way it was done previously, about some towns going back to a phase 2 and other towns not doing it?
I'll start, and you guys can help me out with this. What I heard from municipalities was, hey, look, let's face it, New Haven and Bridgeport, West Haven, Wyndham, a lot of towns took the initiative themselves to roll back to phase 2. Others said I'd be a lot more inclined to roll back to phase 2 if I could get other towns in my cohort, in my region, to do the same thing. And pretty soon, as we looked around, the state was more like one, as you saw the number of red splotches on the map. So I think that was part of the thinking with the towns, and I think they appreciate that. But anybody want to add to that?
No, I think the only thing that would add to that is throughout this whole crisis, the governor has said that he will make any necessary policy changes or steps to make sure to mitigate the spread. One of the things that we've seen is that we're not afraid to make changes and modifications to get to that end. And this is a perfect example today. And I will say also, if you look at our map, we firmly believe that there's going to be increased towns from what it was last week, both in the orange and the red alert levels. So this was important. The governor felt it was extremely important to act now to get people ready, to change behavior, and show leadership on this important measure.
And one other thing on a different topic. We had heard that the Dutcher building at Whiting Forensic was in quarantine for COVID. Other units at CVH are quarantined. Have you given any thought to releasing patients from state-run psychiatric facilities to prevent COVID spread?
Do any of you know about that?
Yeah, I think, even going back to the spring, I think that our commissioners who run agencies that provide direct service and care to our residents demonstrated that they did a great job of taking the actions when needed to prevent spread in our facilities. And we have that much more experience and testing and PPE available even now. So, we're confident that our teams will be prepared to address, any outbreaks that do occur. And we'll continue to, monitor the situation carefully as we go forward.
Thank you.
Hearst, Connecticut Media. Hearst, Connecticut Media.
Yeah, thank you very much, Governor, for getting me barred from West Hartford Center. I wanted to know what the reaction you're getting and working with the Restaurant Association and the caterers going forward. Are there still sort of things that they're trying to work out? For example, specifically this limit of 8 to a table. Can you talk about that in a little bit more detail?
Well, David, you haven't talked to the Restaurant Association in about a half an hour. Do you want to take that?
Yeah, Dan, thanks for the question. So we're in continuous dialogue with the Restaurant Association, really daily dialogue at this point. So I'd say a couple things. One, I think there is a realization that we need to take some steps here to mitigate the spread. And as the governor mentioned, the risk is community spread. We think restaurants, by and large, have been really solid at embracing the safeguard measures, keeping customers safe. But we're at a point now with the increases in virus that community spread is a real risk. So dialing back the capacity to 50%, limiting tables to 8. And if you look at states around us, they are in and around that area. Connecticut was affording more flexibility previously. We felt like this was a measure that could reduce the risk, but still achieve what restaurants needed in terms of their customers. And then importantly, the 9:30 closing time is something we discussed at length with the Restaurant Association. Clearly they would prefer to have more flexibility, in particular on weekends. But we think the point about getting rid of whether it's a bar masquerading as a restaurant and some of these bad actors, I think there is an understanding that this is going to reduce the risk. And most of the restaurants that are doing dinner service, they are going to achieve, hopefully, their revenue goals during that time and not afterwards. So there's definitely a bit of give and take, but we think this reduces the risk in a way that affords them flexibility. And again, we're really trying to avoid a further shutdown later on this year.
And what are the rules? Does that include takeout, or does that only restaurants that are serving alcohol? If they stop serving drinks, can they stay open?
So the dining rooms would need to be closed at 9:30, 7 days a week. But the ability to do takeout, delivery, curbside pickup, that would remain for all restaurants after that hour.
Okay, thank you. And just one more question, Governor, moving to the election. Are you satisfied that the system in place for people without masks to be able to vote outside and not come inside? Or are you satisfied that that's both secure and meets the constitutional requirements?
Look, I got 169 towns and 169 registrars, so they all are making sure that people can exercise their constitutional right to vote and make accommodations for, I hope, those very few people who refuse to wear the mask. For the other 99.9% of you, please wear the mask when you vote.
Thank you.
Connecticut Public Media.
Good afternoon. So the mayors and first selectmen in the so-called red towns, are they going to have any extra powers as the state rolls back to phase 2.1, or are we all on a level playing field again?
I think you answered that question. We're all in a level playing field now, and everybody's going to be at that phase 2 level.
And I know someone just asked about this, but can we confirm that the CVH Wedding Complex is currently under quarantine?
Is that currently under quarantine?
No, cannot confirm that.
CT News Junkie.
Thanks, Max. Governor, you talked last week about extending an executive order regarding outdoor dining at restaurants. There's a number of other executive orders, I think, that are set to expire next week. Will you be extending any other executive orders?
I can't tell you exactly what they are, but if there's anything that ought to be extended, look, we're in a similar situation to where we were in June, so I think those executive orders are probably just as relevant today as they were when they were first executed.
Okay, the work from home recommendation you made, does that apply to all branches of government? I understand there's some people working for the judicial branch who still are required to go in person.
Want to take that, Josh?
Yeah, so to be clear, what the governor's alluding to is where possible. So, certainly for essential businesses, or in the case of our state agencies where we need to go into the office to fulfill our mission and to serve our citizens and our businesses, that needs to continue at this point. I think it's really more around the edges where there's discretion and there's flexibility, as the governor has done throughout this pandemic. We're just, again, encouraging people to take advantage of work from home options, both in the state operations and also in the private sector.
Okay. Commissioner Gifford, you mentioned that the 10 p.m. to 5 a.m. stay-at-home recommendation is just that for right now, a recommendation. Is there some threshold where we would actually consider making a solid curfew policy?
Well, again, as the governor said, we're starting with this recommendation, and I believe that if people take it seriously, change behaviors, limit social gatherings, wear the mask, that can have a real significant impact. So the idea now is to limit social interactions as much as possible, and we'll continue to see how our numbers trend.
It will stay a strong recommendation.
What's that, Governor?
It will stay a strong recommendation.
So at this point, you don't anticipate ever making that a requirement, let's say?
Correct.
Okay. All right. Thank you, everybody.
The Associated Press.
Thank you. Good afternoon, everyone. Were the efforts in southeastern Connecticut unsuccessful, and is that why some of this has to be done on a statewide basis? Or did you learn something from it that you think will help prevent spread in the rest of Connecticut?
I'll start. I wouldn't say unsuccessful. We went into, not Southeast Connecticut, Danbury brought down the infection rate. Norwich brought down the infection rate. So our targeted response can have some success, but it's limited given the nature of the community spread, given what's happening Boston, Providence, Southeast Connecticut. Look at what you see around the rest of the country as the virus is spread. So I think that's why we made this adjustment rather than work on a municipal, work on a statewide basis.
Okay. And Governor, can you just explain a little bit more about the regional travel ban or travel rules? Because you said a couple of things. I just want to make sure with Massachusetts, you're working on that, but it sounds like you're also going to be doing these restaurant restrictions with them too, but then things seem like they're different with New York. I just wonder if you can just clarify where things stand with all these different states.
Well, Sue, there are a lot of moving parts. I think you got that right. Right now, as you know, New York, New Jersey, Connecticut, Rhode Island, we've joined the pact. We can travel back and forth, just given the fact that it's virtually impossible to enforce restrictions there. Massachusetts just wanted another couple of days. I talked to Charlie Baker a fair amount, and we'll have that resolved since we share a big border with Massachusetts as well. Massachusetts, Governor Baker just did an announcement in terms of what he's doing in terms of his comparable rollback. We're trying to do that coincident with him since we have such a big border there.
So the rollbacks will mostly be with Mass, though. You're not going to be working with New York or Rhode Island on these?
I think Rhode Island's going to be alongside of us very soon. Paul speaks to them. He can speak. New York, as you maybe know, they never open their restaurants past 25%. So they already have, at 50%, we've already exceeded where they are right now.
Governor, it's David, if I may here, we do expect, Mass announced this today, we do expect Rhode Island to announce something substantially similar later this week. So this has been in conjunction with those states. And as the governor mentioned, New York had been below us in terms of capacity in many areas. So I think this is perhaps getting us more in line with New York, and certainly our northern and eastern border will be consistent.
Okay. And I understand that the federal government has begun some sort of vaccine distribution rehearsals. Is Connecticut involved in that at all?
Deirdre?
So we've been in touch with our federal partners on vaccine distribution planning and starting to lay the groundwork. Specific rehearsals, not yet. But we're certainly in regular communication with them as they begin to think about deployment and distribution.
And Commissioner, has the federal government, have they said whether or not Connecticut might be among the states that receives the first batches of vaccine? Because they're talking about maybe targeting hot spots. And I don't know if we would be considered a hot spot by them.
Our latest understanding from our federal partners as of last week was that the initial batches of vaccine, when they are approved as safe and effective, would be distributed throughout the country on a per capita basis, not based on anything else.
Oh, okay. All right. Thank you very much, everyone.
The Waterbury Republican American.
Thanks very much. In terms of the limit on social and recreational gatherings, we were at one point down to 5 and up to 10 indoors, 45 outdoors. Is this something that is likely to change if the trend lines continue in the direction they've been heading?
I think the answer to that is yes, Paul. We're obviously talking about that again with Rhode Island and Massachusetts and our other neighbors, so I'll get back to you on that in less than a week, I think.
Okay. And can someone tell me when the last time, because I know, as you pointed out last week, Governor, different 7-day rolling averages are used by different folks doing the measuring. When was the last time that we were at 3.6% on a 7-day rolling average using the system that the state uses?
June 6th.
June 6th.
Okay. And you said hospitalizations are a key metric. Hospitalizations have increased 5 times since they were, I think, 65 on September 1st. And they're more than triple than what they were on October 1st. So could Dr. Gifford give us an idea on what that sort of portends in terms of the outbreak and how it's progressing?
Yes. I think the reason the governor is taking these actions today is he stated at the beginning, is we want to preserve our hospital capacity. It's inevitable that we will see hospitalizations continue to grow given the number of cases that we've seen over the last couple of weeks. And in order to slow that trend and turn things around, we need to decrease the number of cases that we're diagnosing in the community. We need to stop the spread in the community. And so that's why these measures are so important, and it's so important that everyone takes action. As the governor mentioned, in addition to just preventing the cases of COVID in our hospitals and intensive care units, we want to help the healthcare system preserve capacity to take care of heart attacks and cancer cases and strokes and joint injuries and everything else that we need to take care of. So it's really important that in addition to not overwhelming our hospitals and healthcare delivery system with COVID cases, that we preserve that capacity for non-COVID related healthcare, which is so important.
And where do you, well, if we're concerned about things happening in November, does the modeling that the state uses, as limited as it may be, indicate that we're in for the height of the second wave? Does it provide any indication when we might hit the height of a second wave?
I think you heard from Dr. Murphy. We had hoped that it might be in November, and November would get us through to therapies, testing, and then a vaccine. I think now many of the models we've talked about push it out to the end of December or January. But as Josh points out all the time, models change all the time.
Okay, and just one last question. Could I ask you to clarify something? Because earlier you said you were pretty confident that another lockdown wasn't going to happen in the United States of America. But at the same time, before then, you mentioned the possibility that might have to happen here. So could you sort of clear up the inconsistency between what I heard or what I thought I heard?
What I was trying to say is that the reason we've had moved back to phase 2 with these different restrictions is we're doing everything we can to keep our economy open, doing everything we can to allow our businesses to continue to operate, do everything we can to allow you to continue to work remotely or in person as needed, do everything we can to allow your kids to continue to go to school and your kids to go to college. And nobody's thinking about a lockdown, doing everything we can to prevent that from happening. You can look over in Europe, they had to take even more severe measures. I hope that does not have to happen in the United States of America.
Okay, thank you very much.
All right, I think I'm getting the signal here from Max. There was a question about voting. At long last, tomorrow is your day to cast a vote. And we've worked hard to make sure that you can vote safely. And your forefathers have worked hard to make sure that you can vote. You know, Bunker Hill, D-Day, this was all about your right to have a vote about your representative and the direction of your country. And don't take that for granted, and use your right to vote, and vote safely. You don't have to take the risk that some of your forebears did. And for those who are casual, you know, wear the mask. You're wearing the mask to keep yourself safe. You're wearing the mask in respect to keep others with you safe as well. But most importantly, please vote, and we'll see what direction our country is taking for the next 4 years. Thank each and every one of you.